Good day and welcome to the COVID-19 podcast. Now, this is the podcast where we talk anything and everything COVID-19, as well as debunk myths related to the pandemic. My name is, of course, John-Colin Namene, and today we're talking fertility safe after COVID-19 vaccine. And to help me unpack that issue, I am talking to our in-house journalist, Shelleygen Petersen, who wrote a column around that issue. Shelleygen, how's it going?
All good, thank you. How are you doing, John-Colin?
I'm very, very well, thank you. Now, you wrote something about fertility safe after COVID-19 vaccine. Obviously, I'm assuming this has to do with, the issue around are women going to be able to, give birth after having their vaccines, because we understand that their periods have been some way, somehow affected after receiving the vaccine. Can you perhaps just give us a rundown of what your column was about?
Yeah. So essentially, as more women got their COVID-19 jabs, there were a lot of questions around how does it affect a woman's menstrual cycle? Will it affect me being able to bear children at the end of the day? And we have gynecologists around the world picking up on this trend, as women have been reporting on social media, especially that their periods would be longer than usual. They'll overbleed more than usual. And so gynecologists had to step in and just look at the science of it. So what we have seen is that, yes, if you do get your jab within the first 2 days of you getting a jab, if you are on your period, your menstruation period will be longer. Usually be 3 days. Some people have go to 5 days, 7 days. They'll bleed much heavier. Some people are very light bleeders, so they've seen now that they do bleed or they overbleed at some point. And we had to speak to a local gynecologist, Dr. David Mvula, just to explain to us whether it does affect fertility. And he has come out to say and debunk that idea that it does affect fertility. It does not affect, he said. He therefore recommended that a woman rather do keep track of how the period is going, and if they feel that there's something seriously wrong, go into your doctor, have a discussion with him, go into your gynecologist. But if you're just seeing it, if you're just overbleeding for a couple of days and if your period is longer, then take note of that. But it is not an emergency.
Yeah.
It quite often happens when it comes to the vaccine. He says there's no known risk in giving the available COVID-19 vaccines to those on their period, especially those who are breastfeeding. In fact, with breastfeeding, it is an advantage because he said what they've seen is they've seen antibodies, COVID-19, or the vaccine antibodies create in your body, so your body as a mother is stronger, and then those antibodies, as you're breastfeeding, transfer over to the child through the milk. So as they absorb the milk, they're absorbing the antibodies, which makes them stronger against for fighting against COVID-19. If you look at Delta. Now, the Delta strain of COVID-19 has proved that children can be badly affected by COVID-19. We've seen more than 20% of children go into ICU, into hospital, as opposed to they normally just get it, they have a light flu and they're fine, because that's what we saw with the first strain, the original strain of COVID-19. But as the virus mutates and more strains are discovered, it becomes stronger and more resistant. Now, if your child can have those antibodies already through the milk, it means that they are much stronger and able to fight the virus when it comes into their body.
Okay, sorry to cut you there. We'll touch on fertility and breastfeeding and pregnancy.
Yeah.
I just really want to jump back to the periods.
Yeah.
So, in conversation with the gynecologist, did you guys perhaps discuss when the right time is to sort of take the COVID-19 jab? Like, is it perhaps more advisable to take it before your period so it doesn't affect your period while you're on your period, or what is sort of the time issue around taking the vaccine, especially for women who go on their period every month?
He said that at any time is the right time. It doesn't matter. It's just that you will overbleed a bit, but that's about it. It's only that you will overbleed.
So in other words, regardless of what time it is,
Of
even
the
if
month, yes.
even if, let's say, your period is a week away and you do get the vaccine on today, which is Tuesday or whatever,
Yes.
next week when you do get your period, you'll still overbleed anyway.
No. So let's
Oh.
say because I said if you get your jab within 2 to 3 days of you getting your jab and you have your period, then it will be, you will overbleed. But it doesn't matter if you get it a week after you got the jab, it won't affect it at all. It just affects those initial first 3 to 4 days of you getting your period. It will have a effect on it, but it's not an everlasting effect. So it won't last after a week.
Because in any case, the vaccine sort of does affect your body in those first few days
Yes,
anyway.
it does.
So
You
it's
you
just a
felt
play on
it,
that.
yeah.
Of course.
You felt tired. You felt exhausted. Your arm would hurt. Sometimes you have a blocked nose or you have a sore throat. That is all just signs that the vaccine is working.
Exactly.
So your period, you overbleeding, is a sign of the vaccine working, because at the end of the day, it is adjusting. Your body's adjusting to it. Let me say that.
Now let's touch on pregnant women.
Yeah.
Is it safe to get the vaccine while you're pregnant?
So, what he did say was that he advises that pregnant women may choose to delay the vaccine until 12 weeks, the first 12 weeks after giving birth, which is the period during, or not giving birth, conceiving.
Right.
So, if you find out you're pregnant, you must find out how many weeks you are pregnant. So, anytime after 12 weeks, you can go get your vaccine, because during those first 12 weeks, your body and the fetus is most vulnerable.
Yeah.
So, that's the time you need to be a bit more cautious. He said, and I quote his words, "Pregnant women are more likely to become seriously unwell when compared to non-pregnant women, and have a higher risk of their baby being born prematurely if they develop COVID-19 in their third trimester," so that is after 28 weeks.
Yeah.
So what we've also seen when we visited the hospitals during the COVID-19 period is that women were the most affected. They are the most vulnerable. It was quite different in the beginning because we didn't see so many women, but as I said, with the strains that do change and mutate, they become more resistant and they become stronger. At the end of the day, that is a direct threat to the health of women when they are pregnant, because your body is so vulnerable. It now has to share its immune system with a baby one. You are the full in charge person of that baby.
Yeah.
So whatever happens to you will happen to the baby, and vice versa.
Of course.
So therefore, during that time, you are very vulnerable. So it will be, as Dr. Mvula has said, he advises that women do get their jabs. That is 12 weeks after, or after the first 12 weeks, get their jabs so that they are much stronger and able to fight. Because we saw a lot of women in ICU, and most of them did not make it.
It's just quite sad. Well, do you think that this sort of plays towards women being a bit hesitant to get COVID-19 vaccines? I mean, we just basically debunked, it affecting your fertility, and, in detail sort of described what it does to your period and how it affects your body and your period. But, I mean, even with what we've said, some people will still not take it as Bible, you understand? So do you think that issues around fertility and, sort of the woman menstrual cycle sort of does play into the mindset of women wanting to be vaccinated or not wanting to be vaccinated?
So I think the whole misunderstanding came when, in the beginning, you had people say, no, pregnant women are quite fine, they're not vulnerable. And then pregnant women started falling sick and severely sick. So people were like, no, but we are seeing that they are sick, so what are you really telling us? So that could have been the cause of the confusion if you just look at some of the data and information you're getting. Whereas we were told, no, pregnant women are fine. Now you're hearing, no, pregnant women are sick. No, pregnant women can get the shot. No, pregnant women can't get the vaccine. There were a lot of confusion. And now that as the data becomes more clear and it's more accessible, you can truly see that there are more, the reality on the ground is they are more affected by COVID-19.
Of course.
And they've done now studies to see how safe the vaccines are for pregnant women, and therefore they've come to the decision that it is safe, but after 12 weeks. Because at some point you will give birth prematurely if you do have COVID-19 and it is severe. So I think that's where the misinformation came in, purely because of there was a misunderstanding with the data and the reality on the ground. But as we constantly hear the officials say, the credible officials say that the information becomes more clear by every day. So yes, do forgive them if they have data and they record it and they announce it as such, and then they come back and say, no, wait, we were incorrect.
I mean, we're all learning with COVID-19.
100%.
This is a new thing for us.
Yeah.
But from your sort of perspective, as somebody that's on the ground often, especially around these issues, do you think that the information is sort of becoming clearer, and people are doing more about going to the verified websites, going to verified sources, and finding out what is true and what is not. Do you think that, I mean, obviously we have to focus and put our eyes on Namibia because that's where we are, but globally also, do you think that we're moving in the right direction just in terms of knowing how to debunk myths themselves and also just getting the right information at all times regarding COVID-19?
I feel like that I can answer in two parts. You have the part where people are becoming more smart. They're becoming smarter in terms of seeing how to identify misinformation. You have the part of society that does do that now, and they go to the credible sources. For instance, in Namibia, you will go to the newspapers, Facebook sites if you have access to social media. If you don't, you go to your community leader. You go to that activist. You often ask them if this is true. And you go to the radio stations, of course. For instance, if you have a thing like national radio, you will go there because you know it's a credible source and it's proven itself to be credible. But now we've also have a thing where people don't trust the officials. For instance, if I can take the vaccination campaign, people don't want to hear from the minister, oh no, take the jab because I've taken the jab. Because they'll question, did you really take the jab? Didn't you get water? Well, all these questions come about.
Exactly.
But if you have these conversations with, for instance, community people on the ground, people have gained trust, people have spent time with them. These are the people who make sure that their blood pressure levels are correct. If it's not, let's go to the hospital, let's go to the nearest clinic. People must have what we call dinner time discussions, lunchtime discussions, midday discussions. You will rather take advice from someone who has been assisting you, someone who perhaps is at your work and you know that person is knowledgeable, that person always knows what they're talking about. You'd rather hear it from them. Take the vaccine, it's safe, A, B, C, and D. You will rather hear it from your church leader because you know your church leader. That person sometimes knows your family issues, knows your intimate problems, and those are the people that have the trust of the community. Now you need to channel the information through them. Don't be on a high ground and say take the vaccine. People can't relate to you. They haven't built their trust with you, especially with all the reports going around. If you can, for instance, just have channel the information through the people on the ground, the community workers, your activists. Those people will go door to door. Those people who are foot soldiers. If you have those people to share the message, it becomes easier for the community to be able to trust it. Because now they have a reliable source, someone who has helped them, who has proven themselves to be credible to them and trustworthy to them, and then they can share that message through that. So if you have your discussions wherever you are, whether it's under a tree, whether it's when the sun is about to set, and sometimes you and your family go visit this family, have the vaccine discussion, because it's the only way that we are going to get information through. But because we don't have those channels, and some of those channels are, but how can I say, they haven't been established yet. Misinformation still travels, and travels through WhatsApp, travels through Facebook, continuously travels, because people don't establish channels with people on the ground and have discussions.
No, you are very right, I think. Okay, so let's just give a final summary of this before we do end our podcast. So you are saying that because the vaccine in general does affect you when you do get your vaccine the first 3-4 days, it by virtue will affect your entire system. So that means if you are on your period, it will obviously affect your period as well. But there's no need to worry until it does become severe. Then obviously you do see your gynecologist or your GP or whoever it is that you trust, right? You're also saying that the vaccine does not make people infertile, especially women, right? And it's only safe to take it
after
12 weeks of
your first 12 weeks of pregnancy.
Your first 12 weeks of pregnancy. Otherwise, the vaccination is safe for pregnant women. It's safe for when you're on your period. It's safe for women in general, and it will not affect you having kids or not. Yeah. All right. Thank you so much, Shelleygen. This was your COVID-19 podcast. My name is John-Colin Namene, and until next time, cheers.
Bye.